Thank you for those of you that joined in. My name is Dr. Corey Hunter. We're going to be going over regenerative medicine clinical trials that we're doing at our office. This is a little bit about me. I'm a board certified pain management physician. I'm the executive director and founder of the Ainsworth Institute of Pain Management. And I'm an assistant clinical professor of physical medicine rehabilitation at Mount Sinai. So, first, before we get into some of the clinical trials and the stuff that we're doing, I wanted to talk about stem cell therapy as a whole. Is it real or is it a hoax? Stem cell therapy is real. Most of the things that you're probably going to come across in the newspaper or on Facebook or Google searches and generally on the internet, a lot of it is perpetrated by would-be experts. There is no fellowship training in stem cell therapy. People will put that up there that they're specifically trained in it. There is no certification in stem cell therapy. There's no training at all in residencies or fellowships. The only training people get is through research. So most of the people that are doing stem cells that you would see out there that are doing them outside of clinical trials and doing them for cash, they end up taking weekend courses, and there's a reason why they're charging cash for it, because it's not covered by insurance companies. The legitimate stem cells research and regenerative medicine stuff that's out there, aside from PRP, PRP is legitimate, it's just not covered. But most of the other, actually not most, all of the other uses and medical uses for stem cell therapy and regenerative medicine are all still under clinical trials. They're all still not FDA approved yet. So the things you see out there that are cash, people wanting you to come in and be evaluated for free and then pay cash, most of those are scams. Things that I'm going to be going into today are part of clinical trials. These are FDA approved clinical trials ranging from a phase 1 to phase 3. Which means that the FDA is regulating it, which means this is very real. And clinical trials do not cost you anything. Clinical trials, if people qualify, are free. So this is just some of the stuff that's out there. People don't really realize, unfortunately, it's too late, that there are a lot of shady people that are trying to take advantage of desperation of patients by charging them cash and doing whatever it is they can to get money from them. So over the last couple of years, the U.S. government has really cracked down on people trying to take advantage of patients with fraudulent advertising and talking about all these cures. In New York City, the Attorney General has come down on a stem cell clinic that was it was a plastic surgeon from Connecticut who lost his license and then came to New York. Just one day was a plastic surgeon, the next day decided to call himself a stem cell expert. Thankfully, the officials here came down on him and gave him a fine and has forced him to stop practicing. In Florida and in New Jersey, there was a stem cell clinic that was injecting stem cells into people's eyes and blinded several people. So fortunately, it's getting a little bit harder for the shady people to do it, but it's still prevalent. And a way to help it, the FDA has now said that people can no longer basically advertise it. So the FDA is aware of it, and they're basically stopping anybody from using unapproved products. And now even Google has come out and has prevented people from doing these unauthorized ads. For me, doing stem cell research and clinical trials, it's very hard for me to do ads as well, which is good. I'd actually prefer it to be that way. So anybody that's trying to advertise stem cell therapy that's charging cash, and it's not outside of a clinical trial, it's unproven, the powers that be are making it a lot harder. So what is regenerative medicine and how is it used for pain? So now that I've told you none of it's real, so what is it that I'm telling you that is real? So I've been doing research on stem cells for the better part of 25 years. The first part of, before I went to medical school after I graduated college, I did research before I ever even knew I wanted to go into pain at the Miami Project to Cure Paralysis. And I was doing research on paralysis, Parkinson's disease, and other movement disorders, and pain. And we were using at the time embryonic stem cells. Now these are cells that are from fetuses, and it was a very controversial time because obviously with pro-life and fetuses and things of that nature, it became questionable and ethical or moral debate on was it okay to use this tissue. The problem also with these cells were they were not very smart. These cells tended to want to become scar tissue. They didn't really want to become what you wanted them to become in the way you wanted them to become that. So for example, when we were trying to make neurons, so we were trying to make nervous system tissue. So people who had paralysis, there was basically a cut in the telephone line. And we were trying to make new neurons that would reconnect that telephone line so people could walk again. It was almost impossible to get these cells to become neurons instead of scar tissue. And then even when we were able to make them become neurons, they didn't want to make a useful connection. So trying to tell the body that the left pinky toe is supposed to connect to this part of the brain was impossible. So fast forward about 10 years, and a very smart gentleman at my medical school named Ishtok Fisher, a PhD professor there, had decided that why don't we, instead of using stem cells from fetuses, why don't we use a human body's own stem cells from bone marrow? And thus began a whole new generation of stem cell therapy, which is what we're using now. They're called mesenchymal or stromal stem cells. And the way we use them for pain is to basically regrow the worn down tissue and try to make it new again. So in the case of the knee, if a person has what people call bone on bone, where there's no cartilage, what we do is we make new cartilage so that it's not bone on bone anymore. Now there's cushion. Or in the case of a disc, a degenerative disc, when the disc becomes black and it loses all the water inside, basically figure out a way to regenerate that disc and make it young all over again. So that's how we're using it for pain. Now, there's two basic schools of thought between in regenerative medicine. You can use what's called a stem cell or orthobiologics. So stem cells, again, are in clinical trials. They're a cell that's capable of becoming any other cell. It's not pixie dust. You can't just take these cells and put them anywhere and expect them to just become whatever it is that's supposed to be there at that moment. These things are very carefully programmed. So you can't just put them anywhere without having them what we call transfected. This is basically a specific strand of DNA that's in there that tells this cell you're going to become cartilage. You're going to become a cell for a disc. Otherwise, they'll just become whatever they want, and there's nothing to stop them from becoming cancer. So you need to make sure that these cells are specifically cultured in a way, which is why stem cell treatment, just some guy in the mall or somewhere down the street, you can't really trust that, because these cells are just taken from your bone marrow and put back in, and there's nothing to control to make sure that these cells are not cancerous, or they're not going to become cancerous, or these cells are just going to become what you want them to be. The other one are called biologics or orthobiologics. These are also in clinical trials. These have been going on for 10-15 years. People have been looking at the right ones for discs. It was OP1, GDF5, a handful of these, where it's basically a protein or a tissue or an enzyme or amino acid that you put into a part of the body, and then it triggers the body or tricks it into healing itself. So this is let's say a person has a tendon or a disc that it just can't heal anymore. The body doesn't know it has to heal it. You put these biologics in there, and it tells the body, oh yeah, this is something's wrong here, and I'm going to try to heal it. So we'll start with stem cells. So stem cells the body has. You already have an abundance of stem cells, and they're sitting in your bone marrow. And these are basically your body's spare parts on demand. So whenever the body needs a new cell for a liver, or a cell for bone, or whatever it is, it'll tap into this supply, and then it'll tell it to become what it needs to become and repair it. So here's a nice little illustration. So transdifferentiation, it's a really fancy word for what happens when these cells become other cells. So you have your stem cell in the middle, and it can become a cardiac cell for the heart. It become cartilage, which is known as a chondrocyte. It can become a neuron for the spinal cord and the brain, and it can become a muscle cell. So these can turn into just about whatever it is that you want them to turn into, or the body tells them to turn into it. So let's go into something like, say, knee pain. So we have a big red irritated knee because it doesn't have any cartilage, and the bone is grinding on the other side of the bone, and you're getting a whole lot of inflammation, and around we go. Well, let's say, what if you were able to get a stem cell to become a chondrocyte, go inside that knee, and then basically create all new cartilage? Pain goes away. So that's the general idea of how this works. In broader terms, we're looking at it in other ways too. So what if we could get stem cells to go into the hip and to become cartilage and regrow a hip joint? Or what if we were to make one of these turn into a neuron, go into the brain? We could cure things like Huntington's and Parkinson's. So you can't just stick these anywhere and expect them to become whatever it is the body wants, because these cells are just going to figure it out. They have to be under the right conditions, and they have to be cultured in such a way where they've already kind of differentiated a little bit, but stopping just short of becoming a full-fledged neuron or becoming a full-fledged cartilage cell. So then the other half, we have orthobiologics. So this is where I was discussing where we're tricking the body into healing itself. So these have come and gone over time, a lot of them, but now the science has gotten a lot better. So another way of looking at this would be, so at the bottom we have a damaged body part, and then there's a blood vessel that's nearby, and you get an injury, and the body sends off a signal for help, and it reaches that blood vessel, and then these little growth factors will stop along the way, and they'll pick up on that signal, and then they'll know that there's something wrong. They'll travel across the other side of that blood vessel. They'll go into the damaged body part, and then they'll fix it. And then voila, you have repair. So this is how your body repairs cuts and scratches, broken bones, just about anything that you can have. This is what fixes it. So what about those things that don't get better? Well, the problem is the damaged body part is too far away from a blood vessel. So it sends off the signal, but it can't reach the blood vessel. So these growth factors don't know that they have to stop and go to the other side. So this is why things like the knee, when you get an injury in your knee and the meniscus doesn't heal, or you get a cartilage injury inside your hip, the body more or less knows it's there, but that help signal can't get to the other side of that blood vessel, and it can't signal those growth factors to come over to the other side. So these growth factors are sitting naturally in our blood, all over our blood. But the question, the trick is to isolate those growth factors, take them out, and then hand deliver them to that damaged body part. And then you can essentially trick the body into healing itself. So you can hand deliver these growth factors and put them in, and then the body will start triggering the healing cascade. So this is ways to maybe trick the Achilles tendon. So we've been using this with PRP for a while, but PRP can't work on everything everywhere. The trick really as a consumer is knowing that people who tell you can put stem cells anywhere, these are the frauds. Stem cell therapy and orthobiologics, it's not pixie dust. If it was just as simple as putting one cell into any part of the body and healing it, these companies all over the world would not be investing hundreds of millions, if not billions of dollars on research. If it was just as simple as someone opening up a clinic in the mall and taking your bone marrow and putting it back in and fixing your knee. If that were the case, then none of these companies would be researching it, because those things don't always work. So when you're investigating it, look for people who are doing clinical trials or have experience in clinical trials. If they tell you that they're board certified in stem cell therapy, there is no such thing. So look for evidence of research and make sure people are telling you the right things. So what are the clinical trials that we're doing at the Ainsworth Institute? So we're involved in about anywhere from 13 to 15 clinical trials throughout the year, ranging everything from medical devices to opioid alternatives to regenerative medicine and stem cell therapy. So one of the clinical trials that we're doing is for knee pain. It's a company that's researching what we call juvenile chondrocyte. So this is a young cartilage cell that will go into the knee, and it will lay down new cartilage. So it's a company called Tissue Gene, and they already passed their FDA in South Korea, and they're coming here to the United States to do their phase 3 clinical trial. So it's a company called Cologne Tissue Gene, and it's a phase 3 clinical trial looking for patients that are 40 years of age or older, grade 2 to 3 osteoarthritis, and patients will be followed for 24 months. The study, if patients qualify, is completely free of charge, and they're reimbursed for their time and participation. So this is a stem cell study. Again, this is not a scam. This is free to patients who qualify, and you have a 2 in 3 chance of getting stem cells. So we're starting to pre-screen patients now, and patients will be formally randomized, and if they qualify, receive the study drug later on this year. And the other one is for low back. So we do this will be our 4th clinical trial for fixing degenerative disc disease, and this is a company in Japan. So what they've researched is they've isolated a bacteria called the Proteus bacteria, and they've isolated within that a special enzyme called condylyase, which essentially will break down cartilage and other connective tissue. And the idea with this is you put it inside a herniated disc, and it will liquefy some of that herniation and force the body to heal itself. So in essence, this is a way to treat a herniated disc without surgery and just with an injection. So you put this isolated enzyme inside the cell, and it'll trick the body into healing the disc herniation. So it's very cool stuff. It's for patients that are 30 to 70 years of age, single level disc herniation with sciatica, and again, free of charge, and patients will be reimbursed for their time and participation. So they'll pay for your MRIs, they'll pay for parking, they'll pay for treatment with us, they pay for everything. There is no cost to you at all. So for anyone who's interested in the clinical trials or interested more about the treatments that we have, our number here is 212-203-2813. You can visit our website at www.ainsworthinstitute.com to learn some more about some of the other clinical trials that we've had in the past and some of the other ones that are going on, or just email us at info@aimpain.com. And these are tricky times, ladies and gentlemen, so please stay safe and stay healthy. Do what you can to do social distancing. Try to stay inside if necessary, and try to wear masks. Again, if you have any questions, please don't hesitate to reach out to us, and we look forward to hopefully meeting anybody in person. Thank you very much for listening, and have a nice afternoon.